Hello, I'm Seung-Young Oh from the Department of Critical Care Medicine at Seoul National University Hospital, South Korea. We will cover several topics, including the purpose of fluid management, the choice of fluid, why do we need to start fluid management. Intravenous fluid therapy is one of the most basic treatments for critically ill patients. The purposes of fluid therapy can be categorized into we have to choose the adequate type of fluid, to select the appropriate fluid for it, and whether they contain synthetic three spaces where fluids can distribute in human. The proportion of the volume through which the body water is distributed is with positive pressure ventilation suggests that the patient is likely to be fluid responsive. The patient must be in sinus rhythm,